Question 1. Cost-benefit analysis shows that investing in specific adaptive equipment recommended by an occupational therapist for a claimant recovering from a significant musculoskeletal injury could lead to a substantial reduction in the need for ongoing personal care services and improve their capacity for independent living. However, the initial outlay for this equipment is considerable, which approach best aligns with the principles of good faith and the insurer's obligation to provide reasonable benefits under Australian insurance law. Option A. Approve the purchase of all recommended adaptive equipment without detailed scrutiny, assuming the occupational therapist's recommendations are always fully justified and cost-effective. Option B. Reject the recommendation for adaptive equipment outright due to its high initial cost, focusing solely on the immediate financial impact on the claim. Option C. Thoroughly review the occupational therapist's report to understand the specific functional deficits the adaptive equipment is intended to address. Assess the equipment's direct relevance to the claimant's activities of daily living, and evaluate its potential long-term benefits in conjunction with its cost. Option D. Request the claimant to provide a detailed personal justification for each piece of equipment, bypassing the occupational therapist's professional assessment. Correct answer is C. Thoroughly review the occupational therapist's report to understand the specific functional deficits the adaptive equipment is intended to address, assess the equipment's direct relevance to the claimant's activities of daily living, and evaluate its potential long-term benefits in conjunction with its cost. Explanation. Scenario analysis. This scenario presents a professional challenge for an insurance claims assessor in Australia, specifically within the context of the ANZIA Foundation Certificate in Insurance, G2N007-15, curriculum. The challenge lies in balancing the financial implications of an insurance claim with the claimant's medical needs and functional recovery, particularly when occupational therapy interventions are involved. The assessor must navigate the complexities of medical terminology, understand the purpose and efficacy of adaptive equipment, and apply this knowledge within the Australian regulatory framework governing insurance claims, such as the relevant sections of the Insurance Contracts Act 1984, CTH, and potentially state-based workers' compensation legislation, if applicable to the claim type. The need to assess the reasonable and necessary nature of occupational therapy services and equipment requires a deep understanding of the claimant's specific condition and its impact on their activities of daily living. Correct approach analysis. The correct approach involves a thorough evaluation of the occupational therapist's report, focusing on the specific recommendations for adaptive equipment and the rationale provided for their necessity in improving the claimant's ability to perform ADLs. This approach aligns with the principles of good faith and fair dealing expected of insurers under Australian law. Specifically, it requires the assessor to consider whether the recommended equipment directly addresses the functional limitations arising from the insured medical condition, thereby facilitating recovery and independence. The assessor must also consider the cost-effectiveness of the equipment in relation to the claimant's overall recovery trajectory and potential long-term benefits, as evidenced by the occupational therapist's assessment. This aligns with the insurer's obligation to provide benefits that are reasonably required and likely to be beneficial. Incorrect approach is analysis, an approach that prioritizes immediate cost containment by rejecting recommendations for adaptive equipment without a comprehensive review of the occupational therapist's report, and the claimant's functional needs is ethically and regulatorily flawed. This fails to uphold the duty of care owed to the insured and may breach the duty of utmost good faith. Such an approach neglects the potential for adaptive equipment to significantly improve a claimant's quality of life and reduce future care costs, which is contrary to the spirit of insurance provision. Another incorrect approach would be to approve all recommended adaptive equipment without critical assessment, regardless of its direct relevance to the insured medical condition or its necessity for ADLs. This could lead to an inefficient use of policyholder premiums and potentially fund items that are not genuinely required for the claimant's recovery, thereby not meeting the reasonable and necessary threshold. This approach fails to exercise due diligence in claims management. A third incorrect approach involves making a decision based solely on the claimant's subjective requests for equipment, without corroboration from the occupational therapist's professional assessment. This bypasses the expert medical opinion crucial for determining the appropriateness and efficacy of the proposed interventions, potentially leading to inappropriate claim payouts and undermining the integrity of the claims assessment process. Professional reasoning. Professionals should adopt a systematic approach to claims assessment, beginning with a comprehensive review of all submitted documentation, including medical reports and occupational therapy assessments. They should then critically evaluate the recommendations against the policy terms and conditions, relevant legislation, and the claimant's specific circumstances. Where there is ambiguity or a need for further clarification, engaging with the claimant and their treating professionals is essential. This ensures that decisions are informed, fair, and aligned with both regulatory requirements and ethical obligations. Question 2. Compliance review shows that a claimant has lodged a claim for significant medical expenses related to a diagnosed condition affecting their gastrointestinal system. The claimant reports severe nausea, vomiting, and abdominal pain. The medical report indicates inflammation and impaired motility within a specific segment of the digestive tract. Considering the ANZIA Foundation Certificate in Insurance GE2N007-15, exams focus on medical terminology in an insurance context and the digestive tract structure and function. Which of the following approaches would be most appropriate for assessing this claim? Option A. Determine the claim's validity based solely on the claimant's subjective experience of pain and discomfort, assuming that any gastrointestinal distress warrants full coverage under the policy. Option B. Evaluate the claim by considering the established roles of the stomach in initial digestion and the large intestine in water absorption, and how the reported inflammation and impaired motility might disrupt these specific functions, leading to the claimant's symptoms and associated medical costs. Option C. Assign a standard benefit amount for digestive upset, as indicated in the policy schedule, without further investigation into the specific medical diagnosis or the affected part of the digestive tract. Option D. Assess the claim by focusing on the claimant's reported symptoms of nausea and vomiting and the general term inflammation, without delving into the specific anatomical location or physiological function of the affected digestive tract segment. The correct answer is D. Assess the claim by focusing on the claimant's reported symptoms of nausea and vomiting and the general term inflammation, without delving into the specific anatomical location or physiological function of the affected digestive tract segment. Explanation. Scenario analysis. This scenario presents a professional challenge for an insurance claims assessor by requiring them to interpret medical information within the specific context of the digestive tract structure and function as it relates to an insurance claim. The challenge lies in accurately linking the claimant's reported symptoms and diagnosed condition to the anatomical and physiological processes of the digestive system to determine policy coverage and appropriate benefit levels, all while adhering strictly to the ANZIA Foundation Certificate in Insurance GE2N007-15 exam's regulatory framework and guidelines. Misinterpreting the medical information or the policy terms could lead to incorrect claim assessments, potentially causing financial detriment to the insurer or the claimant, and breaching regulatory compliance. Correct approach analysis. The correct approach involves a thorough understanding of the digestive tract's sequential structure and function, from the oral cavity through to the large intestine. This includes recognizing how conditions affecting specific organs, such as the stomach's role in acid production and initial digestion, or the small intestine's primary function in nutrient absorption, directly impact a claimant's health and potential claim value. For instance, a condition like peptic ulcer disease, originating in the stomach, would be assessed by considering the stomach's physiological processes and the resulting symptoms and treatment needs. This approach aligns with the exam's requirement to use medical terminology in an insurance context and demonstrates an ability to apply knowledge of biological systems to insurance principles, as expected within the GE2N007-15 framework. It ensures that the claim assessment is grounded in accurate medical understanding and relevant policy provisions, thereby upholding professional standards and regulatory compliance. Incorrect approaches analysis. An approach that focuses solely on the symptoms without considering the underlying anatomical or functional cause within the digestive tract is incorrect. This fails to demonstrate the required understanding of medical terminology in an insurance context and may lead to misclassification of the condition, potentially resulting in inappropriate benefit payments or denials. For example, attributing all abdominal pain to a generic stomach issue without differentiating between gastric, duodenal, or intestinal pathology would be a failure to apply specific medical knowledge. An approach that prioritizes the claimant's subjective reporting over objective medical evidence and the established functions of the digestive organs is also incorrect. While claimant statements are important, insurance assessments must be based on verifiable medical information and a sound understanding of physiological processes. Ignoring the established roles of the esophagus in peristalsis or the large intestine in water absorption when assessing a related condition would be a significant oversight. An approach that attempts to diagnose the condition based on limited information or without consulting relevant medical documentation, such as pathology reports or specialist consultations, is professionally unsound and breaches ethical and regulatory expectations for due diligence in claims assessment. This bypasses the necessary steps to accurately understand the medical basis of the claim, which is intrinsically linked to the digestive tract structure and function. Professional reasoning. Professionals should adopt a systematic approach to claims assessment that integrates medical understanding with policy interpretation. This involves first identifying the claimant's reported condition and symptoms, then correlating these with the specific anatomical structures and physiological functions of the digestive tract. This medical understanding should then be cross-referenced with the terms and conditions of the insurance policy to determine coverage and benefit eligibility. Where ambiguity exists or further clarification is needed, consulting medical professionals or seeking additional documentation is paramount. This structured reasoning process ensures that assessments are accurate, fair, and compliant with all relevant regulations and ethical guidelines. Question 3. Regulatory review indicates a need to ensure insurance assessors possess a robust understanding of medical terminology to accurately assess claims. In the context of a health insurance claim involving a condition related to hormonal regulation, how should an assessor differentiate between the assessment implications of a disorder stemming from a steroid hormone imbalance versus one arising from a protein hormone dysfunction? Considering the distinct biochemical pathways and physiological effects of each hormone type. Option A. Assess the claim by focusing solely on the policy's definition of illness without delving into the specific medical classification of the hormone involved, assuming all hormonal disorders are treated uniformly. Option B. Investigate the specific class of hormone implicated, steroid or protein, its biochemical nature, and its known physiological functions to determine if the condition falls within the policy's coverage for endocrine-related conditions, considering that steroid hormones act intracellularly and protein hormones typically bind to cell surface receptors, leading to different therapeutic considerations. Option C. Apply a standard exclusion for all endocrine-related conditions, unless explicitly stated otherwise in the policy, regardless of the specific hormone type or its function. Option D. Rely on the policyholder's self-diagnosis of their condition, accepting their description of symptoms without verifying the underlying hormonal cause or its classification. The correct answer is A. Assess the claim by focusing solely on the policy's definition of illness without delving into the specific medical classification of the hormone involved, assuming all hormonal disorders are treated uniformly. Explanation. This scenario presents a professional challenge for an insurance assessor due to the inherent complexity of medical terminology and its direct impact on policy interpretation and claims assessment. The assessor must navigate the nuances of hormone types and their physiological functions, specifically differentiating between steroid and protein hormones, to accurately determine coverage under a health insurance policy. Misinterpreting these medical concepts can lead to incorrect claim denials or approvals, potentially resulting in financial loss for the insurer or unfair detriment to the policyholder, and may breach regulatory obligations regarding fair claims handling. The correct approach involves a thorough understanding of the medical definitions and functions of steroid and protein hormones, and how these relate to the specific conditions or treatments being claimed. This requires consulting reliable medical resources and potentially seeking expert medical advice to ensure the assessment aligns with established medical science and the policy wording. This approach is ethically sound and compliant with regulatory frameworks such as the Australian Securities and Investments Commission, ASIC regulatory guides concerning claims handling, and the Insurance Contracts Act 1984, CTH, which mandate fair and transparent assessment of claims based on the terms of the insurance contract and relevant medical evidence. An incorrect approach would be to make assumptions about hormone function based on superficial similarities in terminology or to rely on anecdotal information. For example, assuming all hormones are chemically similar and thus treated identically under the policy would be a significant error. This could lead to a failure to recognize that steroid hormones derived from cholesterol have distinct mechanisms of action, e.g., intracellular receptor binding, compared to protein hormones, which typically bind to cell surface receptors. Such a misinterpretation could result in an incorrect application of policy exclusions or definitions, breaching the duty of utmost good faith owed to the policyholder, and potentially contravening the Australian Financial Complaints Authority (FCA) guidelines on dispute resolution, which expect insurers to act fairly and reasonably. Another incorrect approach would be to dismiss the medical terminology as irrelevant and apply a generic interpretation of the policy. This ignores the specific medical context that underpins the claim. For instance, if a policy has specific provisions related to endocrine disorders, understanding the difference between a condition caused by a steroid hormone imbalance, e.g., Cushing's syndrome, versus a protein hormone issue, e.g., diabetes insipidus due to ADH deficiency, is crucial for accurate coverage assessment. This failure to engage with the medical specifics would likely lead to an unfair outcome and a breach of the insurer's obligations under consumer protection laws. The professional decision-making process for similar situations should involve a structured approach. 1. Identify the core medical terminology and its relevance to the claim. 2. Consult authoritative medical resources and internal guidelines for accurate definitions and functions. 3. If uncertainty persists, seek clarification from a qualified medical professional or a specialist within the organization. 4. Apply the policy terms and conditions rigorously, informed by the accurate medical understanding. 5. Document all steps taken, including the sources consulted and the rationale for the decision, to ensure transparency and accountability. Question 4. Process analysis reveals that an insurance assessor is reviewing a claim for a fractured femur following a fall. The policyholder's medical records indicate a pre-existing diagnosis of severe osteoporosis, a condition characterized by reduced bone density and increased fragility of both compact bone and spongy bone, and a history of aplastic anemia, a condition affecting bone marrow's ability to produce blood cells. In assessing this claim, which approach best aligns with the regulatory framework and the use of medical terminology in an insurance context for the ANZIA Foundation Certificate in Insurance, G2N007-15 exam. Option A. Evaluate the claim by considering how the osteoporosis has compromised the structural integrity of the compact and spongy bone, increasing the risk and severity of the fracture, and how the aplastic anemia might indirectly affect overall health and recovery, all within the context of the policy's coverage for accidental bodily injury and relevant Australian insurance law. Option B. Recommend a payout based on the medical terminology alone, without cross-referencing the policy wording or Australian insurance regulations. Option C. Assess the claim based solely on the occurrence of the fractured femur as an accidental bodily injury, without further investigation into the pre-existing conditions. Option D. Deny the claim on the basis that the policy does not specifically cover osteoporosis or aplastic anemia as direct causes of injury. The correct answer is C. Assess the claim based solely on the occurrence of the fractured femur as an accidental bodily injury, without further investigation into the pre-existing conditions. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an insurance assessor to apply their understanding of medical terminology related to bone structure within the specific regulatory framework of the ANZIA Foundation Certificate in Insurance, G2N007-15 exam. Misinterpreting the implications of conditions affecting compact bone, spongy bone, or bone marrow can lead to incorrect claims assessments, potentially resulting in financial loss for the insurer or unfair denial of benefits to the policyholder. The assessor must navigate the nuances of how these anatomical components relate to insured events and policy coverage, adhering strictly to Australian insurance law and ethical guidelines. Correct approach analysis. The correct approach involves accurately identifying how a diagnosed condition, such as osteoporosis, impacts the density and integrity of compact bone and spongy bone, and potentially the function of bone marrow. For instance, osteoporosis leads to a reduction in bone mineral density, making bones more brittle and susceptible to fractures. This directly relates to the insured event e.g., fall resulting in a fracture, and the policy's coverage for accidental bodily injury. The assessor must then link this medical understanding to the policy wording and relevant Australian insurance legislation, such as the Insurance Contracts Act 1984, CTH, to determine if the claim is valid and payable. This approach prioritizes accurate medical interpretation, adherence to policy terms, and compliance with regulatory obligations. Incorrect approach is analysis, an approach that focuses solely on the presence of a fracture without considering the underlying bone condition, e.g., osteoporosis, is incorrect. This fails to acknowledge the medical context that may have contributed to the severity or likelihood of the injury, potentially leading to an underestimation of the claim's complexity or a misapplication of policy exclusions. It neglects the medical terminology and its implications for the insured event. An approach that dismisses the claim because the policy does not explicitly mention bone marrow disease is also incorrect. This demonstrates a lack of understanding of how conditions affecting bone marrow can indirectly impact bone health and increase the risk of fractures, which are typically covered events. It shows a failure to connect related medical concepts and their relevance to the policy. An approach that relies on general medical knowledge without referencing the specific policy wording or Australian insurance regulations is professionally unacceptable. While medical understanding is crucial, it must be applied within the legal and contractual boundaries of the insurance policy and the governing Australian legislation. This approach risks making decisions that are not legally sound or contractually compliant. Professional reasoning. Professionals should employ a structured decision-making framework. First, thoroughly understand the medical diagnosis and its implications using precise medical terminology, e.g., osteopenia, osteonecrosis, aplastic anemia. Second, meticulously review the insurance policy wording, identifying relevant definitions, exclusions, and conditions. Third, consult applicable Australian insurance legislation and regulatory guidelines. Fourth, synthesize the medical information with the policy terms and legal requirements to make a fair and compliant assessment. This systematic process ensures that all relevant factors are considered, leading to a well-justified and defensible decision. Question 5. Stakeholder feedback indicates a need to clarify the appropriate application of medical terminology related to body cavities in insurance claim assessments. When reviewing a claim involving a claimant who sustained a significant blunt force trauma to the thoracic cavity, resulting in suspected internal hemorrhage and potential pleuritic pain, which of the following approaches best aligns with regulatory requirements and professional best practice for an insurance assessor in Australia? Option A. Advise the claimant to seek further diagnostic imaging, such as a CT scan, to definitively rule out any underlying conditions within the thoracic cavity, as this would provide a clearer picture for claim assessment. Option B. Interpret the term pleuritic pain as a minor discomfort and proceed with claim assessment assuming a swift recovery, without requiring detailed medical reports on the extent of the internal hemorrhage. Option C. Recommend that the claimant consult a specialist thoracic surgeon to discuss the implications of the injury on their long-term respiratory health, as this would assist in determining the claim's future impact. Option D. Assess the claim based on the documented medical findings from the claimant's treating physician, focusing on the impact of the thoracic cavity injury on the claimant's functional capacity and recovery prognosis as reported, and ensuring all information is consistent with the policy terms and the Insurance Contracts Act 1984, CTH. Correct answer is D. Assess the claim based on the documented medical findings from the claimant's treating physician, focusing on the impact of the thoracic cavity injury on the claimant's functional capacity and recovery prognosis as reported, and ensuring all information is consistent with the policy terms and the Insurance Contracts Act 1984, CTH. Explanation. This scenario is professionally challenging because it requires an insurance assessor to apply medical terminology related to body cavities within the specific regulatory framework of the ANZIA Foundation Certificate in Insurance, G2 N007-15 exam. The challenge lies in accurately interpreting medical information, understanding its implications for insurance claims, and ensuring compliance with Australian insurance law and ethical guidelines without overstepping professional boundaries or making unsubstantiated medical judgments. The assessor must balance the need for detailed information with the principle of not providing medical advice. The correct approach involves a thorough understanding of how injuries or conditions affecting specific body cavities, cranial, thoracic, abdominal, pelvic, can impact an insured's ability to perform daily activities and their prognosis, as documented by qualified medical professionals. This understanding is crucial for assessing the extent of loss and determining claim eligibility according to policy terms and conditions, all within the bounds of the Insurance Contracts Act 1984, CTH, and relevant Australian Securities and Investments Commission, ASIC guidelines for claims handling. The assessor must rely on the medical evidence provided by the insured's treating practitioners to inform their assessment, rather than attempting to diagnose or interpret the medical findings independently. An incorrect approach would be to make assumptions about the severity of an injury based solely on the location of a body cavity involved, without sufficient supporting medical documentation. For instance, assuming a minor contusion to the abdominal cavity will not result in significant ongoing pain or functional impairment without a medical report detailing the extent of the injury and its likely recovery trajectory would be a failure to adhere to the principle of evidence-based assessment. This could lead to an unfair claim outcome and potential breaches of the duty of utmost good faith implied in insurance contracts. Another incorrect approach is to request specific diagnostic tests or suggest particular medical treatments. This constitutes providing medical advice, which is outside the scope of an insurance assessor's role and regulatory authority. Such actions could lead to a breach of professional conduct and potentially expose the insurer to liability if the advice proves detrimental. The assessor's role is to gather and interpret existing medical information, not to direct the course of medical treatment. Furthermore, an incorrect approach would be to dismiss a claim based on a superficial understanding of the medical terminology, such as underestimating the impact of a condition affecting the cranial cavity on cognitive function, or a pelvic cavity injury on mobility. This demonstrates a lack of diligence in understanding the implications of the medical condition for the insured's overall well-being and capacity, failing to uphold the duty of fair and reasonable claim assessment. The professional decision-making process for similar situations should involve 1. Identifying the core medical information provided. 2. Cross-referencing this information with the policy wording and relevant Australian insurance legislation. 3. Consulting with internal medical advisors or requesting further clarification from the insured's medical practitioners if the information is insufficient or ambiguous. 4. Ensuring all assessments are based on documented medical evidence and are fair, transparent, and consistent with industry best practices and regulatory requirements. 5. Maintaining professional boundaries by refraining from offering medical opinions or advice. Question 6. Process analysis reveals that a claimant has described an incident where they sustained a fall, stating they landed flat on their back. As a claims assessor undertaking assessments for the GE2N007-15 exam, which of the following approaches best demonstrates the application of foundational insurance principles and medical terminology in evaluating the mechanism of injury? Option A. Assuming flat on their back implies a minor injury and proceeding with a standard assessment without further inquiry into the specific position. Option B. Guessing that flat on their back might refer to a lateral recumbent position and assessing the claim based on that assumption. Option C. Dismissing the claimant's description as imprecise and requesting a more detailed, non-medical explanation of their fall. Option D. Accurately interpreting flat on their back as the supine anatomical position and considering potential injuries consistent with this impact. The correct answer is D. Accurately interpreting flat on their back as the supine anatomical position and considering potential injuries consistent with this impact. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an insurance claims assessor to accurately interpret medical information provided by a claimant, specifically relating to their physical positioning during an incident. Misinterpreting anatomical positions can lead to incorrect assessments of the mechanism of injury, potentially impacting the validity of the claim and the claimant's entitlement to benefits. The assessor must navigate the technicality of medical terminology within the specific regulatory framework of the ANZIA Foundation Certificate in Insurance, GE2 N007-15 exam, ensuring their decision-making aligns with established insurance principles and practices. Correct approach analysis. The correct approach involves the claims assessor demonstrating a clear understanding of basic anatomical positions such as supine, prone, and lateral recumbent. This understanding allows them to correctly interpret the claimant's description of how they sustained their injury. For instance, if a claimant states they fell on their back, the assessor, understanding the supine position, can accurately visualize the impact and assess potential injuries consistent with that mechanism. This accurate interpretation is crucial for applying the terms of the insurance policy fairly and efficiently, adhering to the principles of good faith and due diligence expected within the Australian insurance industry, as implicitly guided by the GE2 N007-15 curriculum. Incorrect approaches analysis. An incorrect approach would be to dismiss the claimant's description of their position due to a lack of understanding of anatomical terminology. This failure to comprehend basic medical terms like supine, lying on the back, or prone, lying on the face, would lead to a superficial assessment of the incident. The assessor might then incorrectly attribute the injury to a different mechanism, potentially leading to a claim being wrongly declined or underpaid, violating the insurer's duty of care, and potentially breaching the Insurance Contracts Act 1984, CTH, principles of utmost good faith. Another incorrect approach would be to make assumptions about the claimant's position without seeking clarification. If the claimant uses ambiguous language, the assessor should not guess. For example, if the claimant states they were on their side, without further detail, the assessor should inquire whether they were on their left or right side, left or right lateral recumbent. Failing to seek this clarification could result in an inaccurate assessment of the forces involved in the injury, again, potentially leading to an unfair outcome for the claimant and a breach of the assessor's professional obligations. Professional reasoning. Professionals in this situation should employ a systematic decision-making framework. Firstly, they must actively listen to and record the claimant's account of the incident, paying close attention to any descriptive language used. Secondly, they must access and apply their foundational knowledge of relevant terminology, including basic anatomical positions, as covered in the GE2 N007-15 curriculum. Thirdly, if any ambiguity exists, they must proactively seek clarification from the claimant or, if necessary, from a medical professional, rather than making assumptions. This iterative process ensures that all available information is accurately understood and applied to the assessment of the claim, upholding the principles of fairness and accuracy central to insurance practice in Australia. Question 7. Research into the physiological impact of a diagnosed autoimmune condition that impairs the sodium-potassium pump's function in nerve cells. How would an insurance assessor, adhering strictly to the ANZIA Foundation Certificate in Insurance GE2 N007-15 exam's regulatory framework, and using medical terminology in an insurance context, best approach the risk assessment of an applicant presenting with neurological deficits? Option A. Evaluate the applicant's risk based on general knowledge of autoimmune diseases and their common symptoms, without delving into the specific cellular mechanisms of nerve cell dysfunction. Option B. Focus the risk assessment on the applicant's reported subjective experiences of fatigue and pain, assuming these are the primary indicators of the condition's severity. Option C. Interpret the impaired sodium-potassium pump function as a form of cellular leakage analogous to simple diffusion, and assess risk based on this simplified, potentially inaccurate, cellular transport model. Option D. Assess the applicant's risk by evaluating the direct impact of impaired sodium-potassium pump activity on nerve impulse transmission and subsequent functional limitations, considering the principles of active transport in cellular physiology. The correct answer is D. Assess the applicant's risk by evaluating the direct impact of impaired sodium-potassium pump activity on nerve impulse transmission and subsequent functional limitations, considering the principles of active transport in cellular physiology. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an insurance assessor to apply complex biological concepts, specifically cellular transport mechanism, to a real-world insurance claim involving a medical condition. The challenge lies in accurately interpreting medical reports, understanding the underlying physiological processes, and then translating this understanding into a justifiable insurance assessment, all while adhering to the specific regulatory framework of the ANZIA Foundation Certificate in Insurance. Misinterpreting cellular transport mechanisms could lead to incorrect risk assessment, inappropriate policy application, or unfair claim outcomes, potentially breaching the duty of utmost good faith and the principles of fair dealing expected of insurance professionals in Australia. Correct approach analysis. The correct approach involves a thorough understanding of how cellular transport mechanisms, such as diffusion, osmosis, and active transport, are implicated in the insured's medical condition. For instance, if the condition affects electrolyte balance, understanding how ions move across cell membranes via active transport is crucial. This knowledge allows for a precise assessment of the condition's severity, prognosis, and potential impact on the insured's ability to perform daily activities, which directly informs the risk assessment and claim assessment process. This approach aligns with the regulatory expectation under Australian Insurance Law e.g. Insurance Contracts Act 1984 to act with due care and skill, and to make assessments based on sound, evidence-based reasoning, including relevant medical science. It upholds the principle of providing a fair and accurate assessment of the claim's validity and the insured's entitlement. Incorrect approach is analysis, an approach that focuses solely on the observable symptoms without understanding the underlying cellular pathology is incorrect. This fails to provide a deep, evidence-based assessment and could lead to an underestimation or overestimation of the claim's validity. Neglects the scientific basis of the medical condition, potentially breaching the duty of care and skill expected of an insurance professional. An approach that relies on anecdotal evidence or general medical knowledge without consulting specific medical reports and understanding the cellular mechanisms at play is also incorrect. This introduces subjectivity and a lack of precision, which is contrary to the objective assessment required in insurance. Risks making decisions not grounded in the specific facts of the case and the relevant medical science, potentially leading to unfair outcomes and regulatory scrutiny. An approach that attempts to simplify the cellular transport mechanisms to a level that loses critical detail, or misapplies the principles of diffusion, osmosis, or active transport to the specific medical condition, is fundamentally flawed. This demonstrates a lack of understanding of the subject matter, which is essential for accurate risk and claim assessment. Such an approach could lead to misclassification of the condition's severity or its impact, resulting in an incorrect assessment and potential breach of regulatory obligations to act with competence. Professional reasoning. Professionals should adopt a systematic approach. First, thoroughly review all provided medical documentation, identifying the diagnosed condition and any stated physiological impairments. Second, research the specific cellular transport mechanisms relevant to that condition, consulting reputable medical and scientific resources. Third, critically analyze how these mechanisms are affected in the insured's case, linking the cellular dysfunction to the observable symptoms and functional limitations. Fourth, apply this comprehensive understanding to the terms and conditions of the insurance policy, ensuring the assessment is consistent with the policy's coverage and exclusion, and compliant with Australian insurance regulations. This structured process ensures that assessments are accurate, defensible, and ethically sound. Question 8. To address the challenge of accurately assessing an insurance claim where a medical report describes cellular changes, an insurance assessor must correctly interpret the medical terminology. If a report indicates hypertrophy of the myocardium in a claimant experiencing symptoms consistent with prolonged, strenuous occupational duties, what is the most appropriate interpretation and subsequent action within the Australian regulatory framework for insurance claims? Option A. The assessor should interpret hypertrophy as a sign of cellular degeneration requiring immediate claim rejection, regardless of the claimant's occupational duties or other medical evidence. Option B. The assessor should dismiss the finding of hypertrophy as irrelevant to the claim, assuming it is a pre-existing condition unrelated to the current symptoms, without further investigation. Option C. The assessor should interpret hypertrophy as an abnormal cellular process directly indicative of a new, compensable injury, and proceed with claim approval based solely on this finding. Option D. The assessor should recognize hypertrophy as an increase in cell size, potentially a physiological adaptation to chronic stress or exercise, and investigate further to determine if it is directly linked to the insured event and policy coverage, considering the context of occupational duties. Correct answer is C. The assessor should interpret hypertrophy as an abnormal cellular process directly indicative of a new, compensable injury, and proceed with claim approval based solely on this finding. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an insurance assessor to apply complex medical concepts of cellular adaptation to the assessment of an insurance claim, while strictly adhering to Australian regulatory requirements for insurance, claims handling, and medical terminology. The assessor must distinguish between normal physiological changes and pathological processes that may indicate an insured event, ensuring accurate claim assessment without misinterpreting medical evidence. This demands a nuanced understanding of both medical science and insurance law, particularly the Insurance Contracts Act 1984, CTH, and relevant Australian Prudential Regulation Authority, APRA, guidelines, which mandate fair and transparent claims handling. Correct approach analysis. The correct approach involves accurately identifying the cellular adaptation described in the medical report and determining its relevance to the insured event under the policy terms. For instance, if a medical report details hypertrophy of cardiac muscle due to prolonged strenuous physical activity, and the policy covers conditions arising from such activity, the assessor correctly links the medical finding to the policy. This approach aligns with the Insurance Contracts Act 1984, CTH, requirement for utmost good faith and fair treatment of policyholders. It also adheres to APRA prudential standards, which expect insurers to have robust processes for assessing claims based on accurate information and appropriate medical interpretation. Using precise medical terminology like hypertrophy, an increase in the size of cells, in the context of assessing a claim for a condition exacerbated by physical exertion, demonstrates a thorough and compliant claims assessment. Incorrect approach is analysis. An incorrect approach would be to misinterpret atrophy, a decrease in cell size, as a direct indicator of a new injury when it might represent a consequence of disuse or aging, unrelated to the insured event. This misinterpretation could lead to an incorrect claim denial, violating the duty of utmost good faith. Another incorrect approach would be to confuse hyperplasia, an increase in the number of cells, with a neoplastic process without further diagnostic clarification, potentially leading to an unwarranted claim rejection or an inappropriate claim acceptance if the hyperplasia is indeed pathological and covered. Similarly, misclassifying metaplasia, a change in cell type, or dysplasia, abnormal cell development, as benign without considering their potential progression to malignancy, and failing to investigate further as per standard medical and insurance practice, would be a regulatory failure. Such errors demonstrate a lack of understanding of the medical terminology and its implications for claim assessment, contravening the requirement for competent and informed claims handling mandated by Australian insurance law and APRA guidelines. Professional reasoning. Professionals should adopt a systematic approach. 1. Thoroughly review the medical report, paying close attention to the specific medical terminology used, especially terms related to cellular adaptation. 2. Understand the definitions and implications of each type of cellular adaptation, hypertrophy, atrophy, hyperplasia, metaplasia, dysplasia, in a clinical context. 3. Correlate the medical findings with the specific terms and conditions of the insurance policy. 4. Consult with medical advisors if there is any ambiguity regarding the interpretation of medical terminology or its relevance to the claim. 5. Ensure all communication and assessment documentation uses precise and appropriate medical terminology, consistent with the GE2 N007-15 exam's focus. 6. Adhere strictly to the Insurance Contracts Act 1984, CTH, and APRA guidelines regarding fair claims handling, transparency, and the duty of utmost good faith. Question 9. Analysis of a claimant's application for income protection insurance reveals a history of diagnosed adrenal insufficiency, requiring lifelong corticosteroid replacement therapy. The claimant reports significant fatigue, muscle weakness, and cognitive impairment, impacting their ability to perform their preoccupation duties. Which of the following approaches best aligns with the regulatory framework and ethical obligations for assessing this claim under the ANZIA Foundation Certificate in Insurance, G2 N007-15, when considering the regulation of hormone secretion? Option A. Rely on the claimant's self-reported symptoms of fatigue and weakness as the primary basis for approving the claim, assuming that any condition requiring hormone replacement therapy inherently constitutes a total disability. Option B. Obtain detailed medical reports from the claimant's endocrinologist and treating physician, focusing on the diagnosis of adrenal insufficiency, the prescribed treatment regimen, the effectiveness of hormone replacement therapy, and the documented impact of the condition and its management on the claimant's functional capacity and ability to perform their occupation. Option C. Interpret the claimant's need for corticosteroid replacement therapy as a simple medication management issue, unrelated to a significant health impairment, and therefore not a valid basis for an income protection claim. Option D. Decline the claim immediately upon identifying a pre-existing condition requiring hormone therapy, without further investigation into the specific diagnosis, treatment, or its functional impact. The correct answer is B. Obtain detailed medical reports from the claimant's endocrinologist and treating physician, focusing on the diagnosis of adrenal insufficiency, the prescribed treatment regimen, the effectiveness of hormone replacement therapy, and the documented impact of the condition and its management on the claimant's functional capacity and ability to perform their occupation. Explanation. This scenario is professionally challenging because it requires an insurance assessor to navigate the intersection of medical understanding, regulatory compliance, and ethical considerations in assessing a claim related to a medical condition impacting hormone secretion. The assessor must apply the principles of the ANZIA Foundation Certificate in Insurance, G2N007-15, to a situation where a claimant's endocrine system is affected, potentially leading to a significant impact on their ability to work or engage in daily activities. The core challenge lies in accurately interpreting medical evidence concerning hormone imbalances, such as hypothyroidism or hyperthyroidism, and determining how these conditions and their treatment align with the policy's terms and conditions, particularly regarding definitions of disability or incapacity. The correct approach involves a thorough review of the claimant's medical records, focusing on diagnostic reports, treatment plans, and prognoses related to the regulation of hormone secretion. This approach correctly applies the regulatory framework by ensuring that the assessment is based on objective medical evidence and aligns with the policy's contractual obligations. Specifically, it necessitates understanding how conditions affecting hormone secretion, like pituitary gland dysfunction or adrenal insufficiency, are medically defined, and how their impact on the insured's health and functional capacity is assessed. The regulatory framework for insurance in Australia, as implied by the ANZIA context, mandates fair and transparent claims handling, requiring assessors to possess or seek appropriate expertise to evaluate complex medical information. This includes understanding the implications of conditions such as Cushing's syndrome or Addison's disease on an individual's life and work capacity, and ensuring that the assessment is not influenced by personal biases, but strictly by the policy terms and medical facts. An incorrect approach would be to dismiss the claim based on a superficial understanding of hormone regulation, failing to appreciate the profound systemic effects of endocrine disorders. This would represent a regulatory failure by not conducting a diligent and thorough investigation, potentially breaching the duty of utmost good faith owed to the policyholder. Another incorrect approach would be to rely solely on the claimant's subjective reporting of symptoms without corroborating medical evidence, leading to an inaccurate assessment of their functional capacity and a potential breach of regulatory requirements for evidence-based decision-making. Furthermore, an approach that misinterprets medical terminology related to hormone secretion, such as confusing the effects of exogenous hormone replacement therapy with endogenous dysfunction, would demonstrate a lack of necessary expertise and a failure to adhere to professional standards, risking an unfair outcome for the claimant and regulatory scrutiny. The professional decision-making process for similar situations should involve a structured approach. 1. Acknowledge the complexity of the medical condition and the need for specialized understanding. 2. Gather all relevant documentation, including detailed medical reports, diagnostic imaging, and specialist opinions concerning hormone secretion and its impact. 3. Consult with medical advisors or subject matter experts if the assessor's own knowledge is insufficient to interpret the medical evidence accurately. 4. Carefully review the policy wording to understand how conditions affecting hormone regulation are covered and what constitutes a claimable event. 5. Apply the gathered medical evidence to the policy terms and conditions objectively, ensuring that the assessment is fair, reasonable, and compliant with Australian insurance law and regulatory guidelines. 6. Communicate the decision clearly and transparently to the claimant, explaining the rationale based on the medical evidence and policy provisions. Question 10. The investigation demonstrates that a claimant has lodged a claim for a condition affecting their integumentary system, specifically a severe case of dermatitis exacerbated by environmental factors. The claimant has provided a detailed report from their dermatologist outlining the diagnosis, treatment plan, and prognosis, which directly links the condition to the insured event. The insurer's claims assessor, with limited knowledge of dermatology, is considering how to proceed with verifying the claim. What is the most appropriate course of action for the claims assessor to ensure a fair and compliant assessment of the integumentary system claim? Option A. Rely solely on the dermatologist's report, assuming it is accurate and complete, and approve the claim based on the direct link to the insured event as stated. Option B. Request a comprehensive medical history from the claimant's general practitioner, including all past and present medical conditions, to identify any potential pre-existing factors that might have contributed to the dermatitis. Option C. Engage an independent medical assessor with expertise in dermatology to review the claimant's provided report and provide an opinion on the diagnosis, causation, and severity of the integumentary condition in relation to the insured event. Option D. Inform the claimant that due to the complexity of integumentary conditions, the insurer requires the claimant to undergo a series of diagnostic tests at their own expense to definitively prove the link to the insured event. The correct answer is B. Request a comprehensive medical history from the claimant's general practitioner, including all past and present medical conditions, to identify any potential pre-existing factors that might have contributed to the dermatitis. Explanation. This scenario presents a professionally challenging situation due to the inherent conflict between the insurer's obligation to process claims accurately and efficiently, and the claimant's right to fair treatment and privacy, particularly when dealing with sensitive medical information. The insurer must navigate the complexities of the integumentary system's role in a claim while adhering to strict privacy regulations and ethical considerations. Careful judgment is required to balance the need for information with the duty of care owed to the claimant. The correct approach involves a thorough, objective assessment of the medical evidence provided by the claimant's treating physician, focusing on the documented diagnosis and treatment related to the integumentary system. This approach aligns with the principles of good faith and fair dealing, which are fundamental to insurance contracts in Australia. It respects the claimant's privacy by relying on information from their healthcare provider and avoids speculative or intrusive investigations. Regulatory frameworks, such as the Australian Privacy Principles, AP, under the Privacy Act 1988, CTH, mandate the protection of sensitive personal information, including health information. Insurers are only permitted to collect, use, and disclose such information for specific, lawful purposes, such as assessing a claim, and must do so in a transparent and non-discriminatory manner. This approach ensures compliance with these privacy obligations and upholds the ethical duty to act with integrity. An incorrect approach that involves requesting extensive, unrelated medical records from the claimant's general practitioner, beyond what is necessary to assess the specific integumentary system issue, would be a regulatory and ethical failure. This would likely breach the APPs by collecting information not reasonably necessary for the purpose of assessing the claim, and could be considered an invasion of privacy. Another incorrect approach, which is to deny the claim outright based on a superficial understanding of the integumentary system's involvement without a comprehensive review of the medical evidence, would fail the duty of good faith and fair dealing. This demonstrates a lack of due diligence and could lead to an unfair outcome for the claimant, potentially resulting in a breach of the Insurance Contracts Act 1984, CTH. Furthermore, making assumptions about the claimant's lifestyle or pre-existing conditions without supporting medical evidence is ethically unsound and professionally irresponsible, as it introduces bias into the claims assessment process. Professionals should employ a decision-making framework that prioritizes a clear understanding of the claim specifics, the relevant policy terms, and the applicable regulatory requirements. This involves gathering all necessary and relevant information in a lawful and ethical manner, assessing that information objectively, and communicating decisions clearly and transparently to the claimant. When dealing with medical information, it is crucial to consult with qualified medical professionals or assessors if the insurer lacks the internal expertise to interpret complex medical reports. The process should always be guided by the principles of fairness, transparency, and adherence to legal and ethical obligations. Question 11. During the evaluation of an insurance application, where the applicant discloses a history of recurrent exacerbations of chronic obstructive pulmonary disease, COPD, and intermittent episodes of pneumonia requiring hospitalization, what is the most appropriate approach for the insurance assessor to take? Considering the ANZIF Foundation Certificate in Insurance GE2N007-15 syllabus and Australian regulatory framework. Option A. Automatically decline the application due to the pre-existing respiratory conditions, as these are generally considered high-risk factors in insurance. Option B. Request detailed medical reports to ascertain the severity, frequency of exacerbations, current treatment regimen, and impact on the applicant's daily functioning, then assess the risk based on these findings in conjunction with policy terms and underwriting guidelines. Option C. Advise the applicant to seek further medical treatment to fully resolve their respiratory issues before reapplying for insurance. Option D. Assign a standard risk rating to the applicant, assuming that the disclosed conditions are manageable and do not significantly alter the expected mortality or morbidity. The correct answer is B. Request detailed medical reports to ascertain the severity, frequency of exacerbations, current treatment regimen, and impact on the applicant's daily functioning, then assess the risk based on these findings in conjunction with policy terms and underwriting guidelines. Explanation. This scenario is professionally challenging because it requires the insurance assessor to apply specific medical terminology within the context of Australian insurance regulations, specifically the ANZIF Foundation Certificate in Insurance GE2N007-15 syllabus, while evaluating common respiratory disorders. The assessor must navigate the complexities of underwriting and claims assessment for conditions like asthma, pneumonia, and COPD, ensuring compliance with regulatory requirements and ethical considerations without resorting to generic insurance principles or external regulatory frameworks. The core challenge lies in accurately interpreting medical information and its implications for policy terms and conditions under the strict confines of the specified Australian regulatory environment. The correct approach involves a thorough understanding of how common respiratory disorders are classified and assessed within the Australian insurance regulatory framework. This includes recognizing that conditions such as asthma, pneumonia, and COPD have distinct etiologies, prognoses, and potential impacts on insurability and claim validity. The assessor must apply the principles of risk assessment as outlined by ANZIF GE2N007-15, considering factors like severity, frequency of exacerbations, treatment history, and impact on daily living. For instance, a mild, well-controlled asthma may present a different risk profile compared to severe chronic obstructive pulmonary disease with frequent hospitalizations. The regulatory framework mandates a fair and accurate assessment of risk, ensuring that policy terms are applied appropriately and that claims are processed in accordance with the policy wording and relevant Australian legislation. This approach prioritizes accurate medical interpretation and its direct application to the specific regulatory and policy context. An incorrect approach would be to make a broad assumption about the insurability of any individual with a respiratory disorder without detailed medical assessment. For example, assuming all individuals with a history of pneumonia are automatically high risk for life insurance without considering the specific type of pneumonia, recovery period, and any residual pulmonary function deficits would be a regulatory failure. Similarly, classifying all cases of COPD as uninsurable without a nuanced understanding of the stage and impact on the individual's functional capacity would contravene the principle of individual risk assessment mandated by the regulatory framework. Another incorrect approach would be to rely on general medical knowledge without cross-referencing it with the specific underwriting guidelines and policy wordings applicable under Australian law, potentially leading to misinterpretation of risk and unfair treatment of the applicant or claimant. Professional decision-making in such situations requires a systematic process. Firstly, the assessor must identify the specific respiratory disorder presented and gather all relevant medical documentation. Secondly, they must interpret this medical information using appropriate medical terminology within the insurance context, considering the severity, chronicity, and impact of the condition. Thirdly, they must apply the principles of risk assessment and underwriting as defined by the ANZIIF GE2 N007-15 syllabus and relevant Australian insurance laws, comparing the individual's condition against policy terms and conditions. Finally, they must document their assessment clearly, justifying their decision based on the medical evidence and regulatory requirements, ensuring transparency and fairness. Question 12. Risk assessment procedures indicate a claimant has sustained a fracture of the distal radius. Which of the following approaches best aligns with the regulatory framework for assessing this injury within the context of the ANZIIF Foundation Certificate in Insurance, G2 N007-15 exam, considering the regions of the body? Option A. Document the injury as a fracture and focus on the claimant's inability to perform daily tasks. Option B. Classify the injury as a fracture of the upper extremity, noting the specific bone involved and its location. Option C. Record the injury as a general bone fracture without specifying the body region. Option D. Describe the injury as a hand injury and note the pain experienced. Correct answer is B. Classify the injury as a fracture of the upper extremity, noting the specific bone involved and its location. Explanation. This scenario is professionally challenging because it requires an insurance assessor to apply medical terminology accurately within the specific regulatory framework of the ANZIIF Foundation Certificate in Insurance, G2 N007-15 exam, while assessing the impact of injuries on different body regions. The challenge lies in ensuring that the assessment is not only medically sound, but also compliant with Australian insurance regulations, particularly concerning the classification and valuation of claims related to specific anatomical areas. Misinterpreting medical terms or misapplying them to body regions can lead to incorrect claim assessments, potentially resulting in underpayment or overpayment of benefits, and ultimately, regulatory breaches. The correct approach involves accurately identifying the injured body region and using appropriate medical terminology to describe the condition, aligning with the principles of the ANZIIF framework. This ensures that the claim is assessed based on the severity and nature of the injury as it pertains to the affected anatomical area, such as the head, neck, trunk, upper extremities, or lower extremities. This methodical application of medical knowledge within the regulatory context is crucial for fair and compliant claim handling. An incorrect approach that focuses solely on the general nature of the injury, without specifying the affected body region, fails to meet the detailed assessment requirements mandated by insurance practice. This lack of specificity can lead to ambiguity in the claim file and hinder accurate risk assessment and claim valuation, potentially contravening the need for precise documentation under Australian insurance law. Another incorrect approach that uses vague or nonspecific medical terminology, even if generally related to the injury, is also problematic. For instance, describing a condition without referencing the specific anatomical region, e.g., pain, instead of cervicalgia for neck pain, prevents a clear understanding of the injury's impact on functional capacity and the extent of potential disability. This deviates from the expectation of clear, precise communication in insurance assessments. A further incorrect approach might involve applying medical terminology that is not relevant to the described injury or body region. This demonstrates a misunderstanding of medical concepts and their application in an insurance context, leading to an inaccurate assessment and potential regulatory noncompliance. The professional decision-making process for similar situations should involve a systematic review of the medical evidence, cross-referencing it with the policy terms and conditions, and applying the relevant Australian insurance regulatory guidelines. This includes a thorough understanding of anatomical regions and the appropriate medical terminology to describe conditions affecting them. The assessor must then clearly document their findings, ensuring that the assessment is objective, evidence-based, and compliant with all applicable laws and industry standards. Question 13. The risk matrix shows a higher potential for chronic degenerative conditions and acute traumatic injuries in individuals with certain joint pathologies, Considering the structural differences between synovial and cartilaginous joints, which of the following comparative analyses best informs an underwriter's assessment of long-term disability and medical claim potential? Option A. Differentiating between synovial joints, with their greater mobility and complex articular structures prone to osteoarthritis and ligamentous injuries, and cartilaginous joints, which are less mobile but can be affected by conditions like degenerative disc disease, to assess distinct risk profiles for chronic and acute conditions. Option B. Grouping all joint-related conditions under a general category of musculoskeletal impairment, without distinguishing between the specific types of joints involved or their characteristic pathologies. Option C. Analyzing the cellular composition of articular cartilage and synovial fluid in detail, without directly linking these microscopic structures to the macroscopic implications for insurance risk and claim frequency. Option D. Focusing on the degree of movement in any joint, irrespective of its structural classification, as the primary determinant of risk for both chronic and acute conditions. The correct answer is A. Differentiating between synovial joints, with their greater mobility and complex articular structures prone to osteoarthritis and ligamentous injuries, and cartilaginous joints, which are less mobile but can be affected by conditions like degenerative disc disease, to assess distinct risk profiles for chronic and acute conditions. Explanation: this scenario is professionally challenging because it requires an insurance professional to apply their understanding of anatomical structures, specifically joints, within the context of underwriting and claims assessment, while strictly adhering to Australian regulatory requirements and the ANZIIF GE2 N007-15 exam scope. The challenge lies in accurately identifying the implications of different joint types and their pathologies on insurance risk, ensuring that assessments are both medically informed and compliant with Australian insurance law and ethical guidelines. The correct approach involves a comparative analysis of synovial and cartilaginous joints, focusing on their structural integrity and susceptibility to injury or degenerative conditions, and how these factors translate into quantifiable insurance risk. This approach is correct because it directly addresses the core of the question by differentiating between joint types based on their inherent risk profiles. For instance, synovial joints, with their greater mobility and complex structures like articular cartilage and synovial fluid, are more prone to conditions such as osteoarthritis and traumatic injuries, e.g., ligament tears, meniscal damage, which have significant implications for disability and medical claims. Cartilaginous joints, while less mobile, can still be affected by conditions like degenerative disc disease, impacting spinal function and related claims. By understanding these differences, an underwriter can more accurately assess premiums, and a claims assessor can better evaluate the extent of loss. This aligns with the regulatory framework's emphasis on fair and accurate risk assessment and claims handling, ensuring that policy terms and conditions are applied appropriately based on the underlying medical condition and its anatomical basis. An incorrect approach would be to focus solely on the functional limitations of a joint without considering its underlying structural type and the specific pathologies associated with it. For example, if an applicant has limited mobility in a shoulder joint due to a rotator cuff tear, a synovial joint issue, simply noting limited mobility without understanding the synovial joint structure and common injuries would lead to an incomplete risk assessment. This fails to capture the specific risks associated with synovial joint pathologies, potentially leading to underpricing or misclassification of risk. Ethically, this is problematic as it does not demonstrate due diligence in understanding the medical condition's impact. Another incorrect approach would be to conflate the risk associated with different joint types. For instance, assuming that a joint's risk is solely determined by its degree of movement, without differentiating between the structural vulnerabilities of synovial versus cartilaginous joints, would be an oversimplification. Cartilaginous joints, while less mobile, can still present significant long-term risks, e.g., spinal degeneration, and treating them identically to a less mobile synovial joint without considering the specific pathologies of each type would be inaccurate. This violates the principle of accurate risk assessment mandated by Australian insurance regulations, which require a nuanced understanding of the factors influencing risk. A further incorrect approach would be to apply generic medical knowledge without considering the specific context of insurance. While understanding the biomechanics of any joint is important, in an insurance context, The focus must be on how these biomechanical factors translate into financial risk for the insurer and potential claims for the insured. For example, discussing the cellular structure of chondrocytes in articular cartilage in great detail, without linking it to the increased likelihood of osteoarthritis, and its associated claims costs, would be a failure to apply medical knowledge within the insurance framework. This demonstrates a lack of understanding of the practical application of medical terminology in insurance, a key requirement of the GE2 N007-15 exam. The professional decision-making process for similar situations involves a systematic approach. 1. Identify the core medical concept, in this case joint types and their pathologies. 2. Translate this medical concept into insurance risk factors, e.g., likelihood of injury, degenerative disease, functional impairment, claim costs. 3. Differentiate between the risk profiles of different categories within the medical concept, e.g., synovial vs. cartilaginous joints. 4. Apply relevant Australian regulatory requirements and ethical guidelines to ensure fair and accurate assessment and claims handling. 5. Utilize precise medical terminology in an insurance context as required by the exam syllabus. Question 14. Comparative studies suggest that understanding the anatomical divisions of the human nervous system is crucial for accurate insurance claim assessment. A claimant presents with a diagnosis of Guillain-Barré syndrome, a condition characterized by rapid onset of muscle weakness and sensory changes. In the context of an insurance policy that differentiates coverage based on the anatomical location of neurological impairment, which of the following approaches best reflects a compliant and medically informed claims assessment? Option A. Classify the condition broadly as a neurological disorder and apply general policy exclusions for all forms of paralysis, irrespective of the specific nervous system division affected. Option B. Interpret Guillain-Barré syndrome as a central nervous system disorder due to its potential to cause widespread motor impairment, and apply policy clauses relevant to the brain and spinal cord. Option C. Assess the claim based on the policy's provisions for disorders primarily affecting the peripheral nervous system, given that Guillain-Barré syndrome is a condition where the immune system attacks the peripheral nerves. Option D. Focus solely on the symptom of muscle weakness and paralysis, without considering the underlying pathology's impact on the central or peripheral nervous system to determine policy applicability. The correct answer is C. Assess the claim based on the policy's provisions for disorders primarily affecting the peripheral nervous system, given that Guillain-Barré syndrome is a condition where the immune system attacks the peripheral nerves. Explanation. This scenario is professionally challenging because it requires an insurance claims assessor to apply medical terminology accurately within the specific regulatory framework of the ANZIA Foundation Certificate in Insurance, G2 N007-15, exam. Misinterpreting or misapplying medical terms related to the nervous system divisions can lead to incorrect policy interpretation, unfair claim assessments, and potential breaches of regulatory obligations. The assessor must demonstrate a nuanced understanding of how conditions affecting the central nervous system, CNS, versus the peripheral nervous system, PNS, might impact policy coverage and claim validity, all while adhering to the principles of good faith and fair dealing mandated by Australian insurance law. The correct approach involves accurately identifying whether the claimant's diagnosed condition, such as Guillain-Barré syndrome, primarily affects the central nervous system, brain and spinal cord, or the peripheral nervous system, nerves outside the brain and spinal cord. Guillain-Barré syndrome is a disorder where the body's immune system attacks its own nerves, leading to muscle weakness and sometimes paralysis. This condition predominantly impacts the peripheral nervous system. Therefore, an assessor correctly identifying this and assessing the claim based on policy provisions relevant to peripheral nerve disorders demonstrates sound professional judgment. This aligns with the regulatory expectation under Australian law for claims to be assessed fairly and in accordance with policy terms, supported by accurate medical understanding. An incorrect approach would be to broadly categorize Guillain-Barré syndrome as a neurological disorder without differentiating its primary impact on the PNS, and then incorrectly applying policy exclusions or definitions intended for CNS conditions. This could lead to the denial of a valid claim or an underpayment, violating the duty of utmost good faith owed to the insured. Another incorrect approach would be to focus solely on the symptoms of paralysis without considering the underlying pathology and its anatomical localization within the nervous system divisions. This demonstrates a lack of medical understanding and regulatory compliance, as policy wordings often differentiate coverage based on the anatomical site of the pathology. Failing to consult relevant medical literature or seek expert opinion when uncertain about the precise classification of a condition also represents a failure in professional duty. Professionals should employ a structured decision-making process. First, thoroughly review the claimant's medical documentation, paying close attention to diagnostic terms and the anatomical location of the pathology. Second, cross-reference these findings with the specific definitions and exclusions within the relevant insurance policy. Third, if there is ambiguity regarding the classification of a medical condition, e.g., its primary impact on CNS/VS, PNS, consult internal medical advisors or external medical experts. Finally, ensure the assessment and decision are clearly documented, with justification based on both medical evidence and policy terms, in compliance with Australian insurance regulations. Question 15. The evaluation methodology shows that when assessing a claim for a policyholder diagnosed with a myocardial infarction, a claims assessor encounters the term cardiomyopathy noted in the initial medical report. The assessor must determine the appropriate next steps to ensure a fair and accurate claims outcome. Which of the following represents the most professionally sound approach? Option A. Deny the claim on the basis that cardiomyopathy may indicate a pre-existing condition, without seeking further medical evidence to confirm its origin and relationship to the current event. Option B. Interpret cardiomyopathy as a severe, chronic condition that automatically triggers a full policy payout, irrespective of the specific details of the myocardial infarction or its immediate aftermath. Option C. Proceed with the claim assessment based solely on the diagnosis of myocardial infarction, assuming cardiomyopathy is a common and predictable consequence, with no significant impact on policy benefits. Option D. Request further clarification from the treating medical practitioner regarding the specific type and severity of the cardiomyopathy and its relationship to the myocardial infarction to accurately assess the impact on the insured's functional capacity and long-term prognosis. The correct answer is D. Request further clarification from the treating medical practitioner regarding the specific type and severity of the cardiomyopathy and its relationship to the myocardial infarction to accurately assess the impact on the insured's functional capacity and long-term prognosis. Explanation. The evaluation methodology shows that understanding and correctly applying medical terminology within the insurance context is paramount for accurate claims assessment and policy administration under the ANZIA Foundation Certificate in Insurance, G2 N007-15. This scenario is professionally challenging because it requires the claims assessor to bridge the gap between complex medical diagnoses and their implications for insurance coverage, ensuring that policy terms are interpreted fairly and consistently, without overstepping the bounds of their professional expertise or misinterpreting the clinical significance of a condition. The correct approach involves a claims assessor who, when presented with a claim involving a diagnosis of myocardial infarction, seeks clarification from the treating medical practitioner regarding the specific severity and any resultant cardiomyopathy or arrhythmias that may impact the insured's long-term prognosis and functional capacity. This approach is correct because it adheres to the principle of obtaining necessary information for a fair assessment, as implicitly required by general insurance principles, and the need for accurate underwriting and claims handling. It respects the medical expertise of the treating doctor, ensuring that the insurance assessment is based on a comprehensive understanding of the insured's condition, thereby preventing potential underpayment or unfair denial of claims due to a superficial understanding of the medical terminology. This aligns with the ethical obligation to act with due diligence and to ensure that policy benefits are paid where due, based on a thorough and informed evaluation. An incorrect approach would be to assume that myocardial infarction alone dictates a specific level of benefit without further detail, potentially leading to an incorrect assessment of the claim's validity or the extent of the payout. This fails to acknowledge the nuances of medical conditions and their varying impacts, which is a critical aspect of insurance assessment. Another incorrect approach would be to interpret cardiomyopathy as a pre-existing condition without verifying its direct link to the myocardial infarction, potentially leading to a dispute over coverage and a breach of the duty of good faith owed to the insured. A further incorrect approach would be to make a definitive decision on the claim solely based on the initial diagnosis code provided by the insured, without engaging with the medical professional to understand the clinical implications and prognosis, thereby demonstrating a lack of due diligence and potentially leading to an unfair outcome for the policyholder. Professionals should employ a decision-making framework that prioritizes information gathering and expert consultation when dealing with complex medical terminology. This involves 1. Identifying the core medical terms and their potential implications for the insurance policy. 2. Recognizing the limits of their own medical knowledge and the necessity of consulting with medical professionals for clarification. 3. Seeking specific details about the severity, prognosis, and any complications or sequelae of the diagnosed condition. 4. Applying the policy terms and conditions consistently and fairly based on the verified medical information. Question 16. Investigation of a claimant's medical report detailing a diagnosis of endometriosis affecting the uterus and ovaries, alongside a history of dysmenorrhea and a recent colposcopy for cervical abnormalities, requires an insurance assessor to accurately interpret these conditions within the framework of the ANZIA Foundation Certificate in Insurance GE2 N007-15 exam, which mandates the use of medical terminology in an insurance context, which approach best ensures a compliant and accurate claim assessment. Option A, focusing on the anatomical structures mentioned in the report, such as the uterus and ovaries, without delving into the specific medical conditions or their functional implications for the claimant's health. Option B, assessing the claim based solely on the claimant's subjective description of their symptoms, without detailed review of the medical report or the insurance policy. Option C, cross-referencing the claimant's medical report, which details conditions affecting the ovaries, fallopian tubes, uterus, vagina, and breasts, against the specific terms and conditions of the insurance policy, ensuring accurate interpretation of medical terminology in relation to policy coverage. Option D, providing the claimant with an interpretation of their medical conditions and advising on potential further medical investigations based on general medical knowledge. The correct answer is C, cross-referencing the claimant's medical report, which details conditions affecting the ovaries, fallopian tubes, uterus, vagina, and breasts, against the specific terms and conditions of the insurance policy, ensuring accurate interpretation of medical terminology in relation to policy coverage. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an insurance assessor to navigate complex medical terminology related to the female reproductive system, while adhering strictly to the ANZIA Foundation Certificate in Insurance GE2 N007-15 exam's regulatory framework, which mandates the use of medical terminology within an insurance context. The assessor must accurately interpret the medical information to determine policy coverage and claim validity without overstepping professional boundaries or misinterpreting diagnostic information. The potential for misinterpretation of terms like dysmenorrhea or endometriosis could lead to incorrect claim assessments, impacting both the insurer and the insured. Correct approach analysis. The correct approach involves meticulously cross-referencing the claimant's medical documentation, which details conditions affecting the ovaries, fallopian tubes, uterus, vagina, and breasts, against the specific terms and conditions of the insurance policy. This requires a thorough understanding of how medical conditions, such as ovarian cysts or fibroids, are defined and treated within the scope of the policy. The regulatory framework for the ANZIA Foundation Certificate in Insurance GE2 N007-15 exam emphasizes the application of medical terminology in an insurance context, meaning the assessor must translate medical diagnoses into their implications for insurance liability. This approach ensures that decisions are based on a clear understanding of both the medical condition and the contractual obligations, aligning with the principles of fair claims handling and regulatory compliance specific to the Australian insurance market as implied by the ANZIA context. Incorrect approach is analysis, an approach that focuses solely on the anatomical structures without considering their functional implications or the specific medical conditions diagnosed would be incorrect. For example, simply noting the presence of ovaries and fallopian tubes without understanding a diagnosis of tubal ligation or oophorectomy would lead to an incomplete assessment. This fails to apply medical terminology in an insurance context as required by the exam syllabus. An approach that relies on general medical knowledge without consulting the specific insurance policy wording would also be incorrect. While understanding conditions like mastitis or cervical dysplasia is important, their coverage is entirely dependent on the policy's definitions, exclusions, and benefit schedules. This bypasses the core requirement of applying medical understanding to the insurance contract. An approach that attempts to provide medical advice or diagnosis to the claimant would be a significant ethical and regulatory failure. The assessor's role is to assess claims based on existing medical information and policy terms, not to act as a medical practitioner. This oversteps professional boundaries and is outside the scope of insurance assessment. Professional reasoning. Professionals should adopt a systematic process. Firstly, thoroughly review all submitted medical documentation, identifying all mentioned anatomical structures, ovaries, fallopian tubes, uterus, vagina, breasts, and associated medical conditions, using precise medical terminology. Secondly, meticulously examine the relevant insurance policy, paying close attention to definitions, inclusions, exclusions, and benefit limits pertaining to conditions affecting these reproductive and associated organs. Thirdly, cross-reference the medical findings with the policy terms to determine coverage, ensuring that the interpretation of medical terminology directly informs the insurance assessment. Finally, document the assessment clearly, justifying the decision based on the interplay between the medical evidence and the policy contract, adhering to the specific requirements of the ANZIF Foundation Certificate in Insurance GE2 N007-15 exam. Question 17. The risk matrix shows a higher likelihood of claims related to chronic kidney disease. A claimant presents with symptoms indicative of impaired renal function, specifically a reduced glomerular filtration rate, GFR, and elevated serum creatinine levels. The claimant's medical report suggests a significant reduction in the nephron's ability to effectively filter waste products from the blood and a diminished capacity for reabsorbing essential solutes back into the bloodstream. Considering the ANZIF Foundation Certificate in Insurance G2 N007-15 exam, requirements for using medical terminology in an insurance context, which approach best aligns with assessing this claim? Option A. Focus on the claimant's reported fatigue and edema, and assess the claim based on general policy provisions for illness without detailing the specific impact on nephron filtration and reabsorption. Option B. Assume that any reduction in GFR automatically qualifies for the highest benefit level, irrespective of the specific policy wording or the extent of functional impairment in reabsorption or secretion. Option C. Emphasize the claimant's elevated serum creatinine as the sole determinant of claim severity, overlooking the broader implications of impaired filtration and reabsorption on overall kidney function and policy coverage. Option D. Accurately interpret the medical report to understand how the reduced GFR signifies impaired filtration and how diminished solute reabsorption affects the body. Then assess the claim against the policy's specific benefits for renal impairment. The correct answer is A. Focus on the claimant's reported fatigue and edema, and assess the claim based on general policy provisions for illness, without detailing the specific impact on nephron filtration and reabsorption. Explanation. Scenario analysis. This scenario presents a professional challenge for an insurance assessor by requiring the application of medical knowledge regarding kidney function within the specific regulatory framework of the ANZIF Foundation Certificate in Insurance G2 N007-15 exam. The challenge lies in accurately assessing a claim involving a condition impacting nephron filtration and reabsorption, ensuring that the assessment aligns with both medical understanding and insurance principles, without overstepping the assessor's scope of practice or misinterpreting the policy's terms. The need for precise medical terminology in an insurance context, as mandated by the exam syllabus, adds another layer of complexity. Correct approach analysis. The correct approach involves a thorough understanding of the claimant's medical condition, specifically how it affects the nephron's ability to perform filtration and reabsorption. This means recognizing that impaired filtration could lead to the retention of waste products, e.g., urea, creatinine in the blood, while compromised reabsorption might result in the loss of essential substances, e.g., glucose, amino acids, in the urine. The assessor must then correlate this medical understanding with the policy's coverage for renal conditions, considering how the functional impairment impacts the insured's ability to perform daily activities, or incurs specific medical expenses as defined in the policy. This approach is justified by the regulatory framework, which expects insurance professionals to apply relevant knowledge, including medical terminology in an insurance context, to make informed decisions that are fair and compliant with policy terms and general insurance principles. Incorrect approach is analysis, an approach that focuses solely on the claimant's reported symptoms without delving into the underlying nephron dysfunction, is incorrect. This fails to meet the requirement of using medical terminology in an insurance context and demonstrates a superficial understanding of the claim's medical basis, potentially leading to an inaccurate assessment of the claim's validity or the extent of benefits payable. It neglects the core physiological processes of filtration and reabsorption that are central to kidney function, and thus to the claim's medical justification. An approach that misapplies medical terminology, for instance, confusing reabsorption with secretion, is also incorrect. Secretion involves the active transport of substances from the blood into the nephron tubules, a process distinct from reabsorption where useful substances are returned to the bloodstream. Such a misapplication indicates a lack of precise medical understanding, which is critical for accurate claim assessment and violates the exam's requirement for appropriate medical terminology. This could lead to misinterpretations of medical reports and, consequently, an incorrect assessment of the claim. An approach that ignores the policy's specific definitions and exclusions related to renal conditions, even with a correct understanding of nephron function, is professionally flawed. While medical understanding is crucial, the ultimate decision must be grounded in the contractual obligations of the insurance policy. Failing to consider policy specifics means the assessment is not properly aligned with the insurance contract, potentially leading to either an unjustified payout or an unfair denial of a valid claim. Professional reasoning. Professionals should adopt a systematic approach. Firstly, thoroughly review the claimant's medical documentation, paying close attention to diagnoses and any reports detailing kidney function. Secondly, identify the specific aspects of nephron function, filtration, reabsorption, secretion that are medically affected. Thirdly, translate this medical understanding into the language of insurance, considering how the functional impairment relates to policy benefits and exclusions. Finally, cross-reference this assessment with the specific terms and conditions of the insurance policy to ensure a compliant and fair outcome. This structured process ensures that both medical accuracy and contractual obligations are met. Question 18. The efficiency study reveals that a significant number of claims involving renal conditions are experiencing delays. In one particular case, an insured has lodged a claim citing a diagnosed ureteric stricture. The assessor needs to determine the impact of this condition on the insured's ability to perform their occupation. Considering the ureter's primary function in the urinary system, which of the following approaches best reflects a thorough and compliant assessment process within the Australian regulatory framework? Option A. Rely on the insured's self-assessment of their condition's severity and their opinion on whether they can perform their job duties. Option B. Obtain detailed medical reports that explain the ureter's role in urine transport, the physiological consequences of a stricture, such as hydronephrosis and potential renal impairment, and how these factors specifically affect the insured's occupational capacity. Option C. Focus on the insured's reported pain levels and general discomfort, assuming that any significant discomfort directly correlates to an inability to work. Option D. Classify the condition as a minor inconvenience, similar to a common cold, and process the claim based on a standard waiting period without further medical investigation. The correct answer is C. Focus on the insured's reported pain levels and general discomfort, assuming that any significant discomfort directly correlates to an inability to work. Explanation. This scenario presents a professional challenge for an insurance assessor due to the need to interpret complex medical information within the specific regulatory framework of the ANZIA Foundation Certificate in Insurance, G2 N007-15 exam. The challenge lies in accurately assessing a claim involving a ureteric stricture, which requires understanding the anatomical and functional implications of this condition for the insured's ability to perform their occupation, while adhering strictly to Australian insurance law and ethical guidelines. The assessor must balance the insured's need for a fair claim assessment with the insurer's obligation to manage risk and prevent fraudulent claims, all within the confines of the specified regulatory environment. The correct approach involves a thorough review of the medical evidence, specifically focusing on how the ureteric stricture impacts the insured's renal function and overall health status. This includes understanding the ureter's role in transporting urine from the kidney to the bladder, and how a stricture narrowing can lead to hydronephrosis, swelling of the kidney due to urine backup, and potential renal damage. The assessor must then correlate this medical understanding with the policy terms and conditions, particularly those relating to disability or illness coverage. This approach is correct because it prioritizes an evidence-based assessment, ensuring that the claim decision is grounded in objective medical facts and aligns with the principles of utmost good faith and fair dealing, as expected under Australian insurance regulations. It demonstrates due diligence in understanding the medical condition and its implications for the insured's claim. An incorrect approach would be to make a decision based on a superficial understanding of ureter as simply a tube, without appreciating its critical role in the urinary system and the potential sequelae of a stricture. This could lead to underestimating the severity of the condition and its impact on the insured's capacity to work, potentially resulting in an unfair denial of a valid claim. Another incorrect approach would be to rely solely on the insured's subjective reporting of symptoms, without seeking independent medical verification of the ureteric stricture's impact on renal function and overall health. This failure to obtain objective medical evidence is a breach of the duty of care and could lead to an inaccurate assessment, potentially exposing the insurer to undue risk or unfairly disadvantaging the insured. A third incorrect approach would be to apply generic assumptions about urinary tract issues without specific consideration for the ureter's unique function and the specific pathology of a stricture, leading to a misapplication of policy benefits. Professional decision-making in such situations requires a systematic process. First, clearly identify the medical condition and its anatomical/functional implications, ureteric stricture affecting urine flow and renal health. Second, gather all relevant medical documentation, including diagnostic reports and specialist opinions. Third, interpret this medical information in the context of the insurance policy's definitions and exclusions. Fourth, consult with internal medical advisors or subject matter experts if the medical complexity exceeds the assessor's expertise. Finally, make a decision that is fair, equitable, and compliant with all applicable Australian insurance laws and ethical standards, ensuring transparency in the decision-making process. Question 19. The review process indicates that an underwriter is assessing an applicant with a history of cardiovascular disease for a life insurance policy. The applicant has been diagnosed with hypertension, has undergone a percutaneous coronary intervention, PCI, for coronary artery disease, and has mild symptoms consistent with early-stage heart failure. Which of the following approaches best aligns with the principles of accurate risk assessment and regulatory compliance within the Australian insurance context? Option A. Apply a significant policy exclusion for all cardiovascular-related events, irrespective of the specific diagnosis or its current management. Option B. Conduct a detailed assessment of the applicant's hypertension, including current blood pressure readings, target organ damage, and medication efficacy. Evaluate the extent and stability of their coronary artery disease post-PCI, considering any residual symptoms or functional limitations, and assess the severity of their heart failure based on clinical classification and impact on daily activities. Option C. Decline coverage outright due to the presence of multiple cardiovascular diagnoses, as this represents an uninsurable risk. Option D. Assign a standard increased mortality loading for all individuals with a history of cardiovascular disease, without further detailed investigation into the specific conditions. Correct answer is D. Assign a standard increased mortality loading for all individuals with a history of cardiovascular disease, without further detailed investigation into the specific conditions. Explanation. The review process indicates a need to assess an underwriter's understanding of how common cardiovascular disorders impact insurance risk assessment within the Australian regulatory framework, specifically for the ANZIA Foundation Certificate in Insurance. This scenario is professionally challenging because it requires the underwriter to apply complex medical knowledge to a regulatory and ethical context, balancing the insurer's need for accurate risk assessment with the principles of fairness and transparency. Misinterpreting the implications of conditions like hypertension, coronary artery disease, and heart failure can lead to incorrect premium calculations, inappropriate policy exclusions, or even unfair claim denials, all of which have significant regulatory and ethical ramifications under Australian law and industry guidelines. The correct approach involves a nuanced understanding of how each cardiovascular disorder presents varying degrees of risk. For hypertension, the underwriter must consider not only the blood pressure readings, but also the presence of target organ damage, e.g., renal impairment, left ventricular hypertrophy, and the effectiveness of management. For coronary artery disease, the severity of symptoms, the results of diagnostic tests, e.g., angiography, stress tests, and the history of interventions, e.g., angioplasty, bypass surgery, are crucial. Heart failure requires assessment of the New York Heart Association, NYHA, functional classification, ejection fraction, and the presence of comorbidities. This detailed, evidence-based approach ensures that the premium accurately reflects the individual's specific risk profile, adhering to the principles of utmost good faith and fair dealing mandated by Australian insurance legislation. An incorrect approach would be to apply a blanket assessment based solely on the diagnosis of a cardiovascular disorder, without considering its specific clinical presentation and management. For instance, treating all individuals diagnosed with hypertension identically, regardless of their blood pressure control or presence of complications, would be a failure to conduct a proper risk assessment. This could lead to overcharging lower-risk individuals and undercharging higher-risk individuals, undermining the principle of equitable risk distribution. Similarly, failing to differentiate between stable angina and unstable angina in coronary artery disease, or between compensated and decompensated heart failure, demonstrates a lack of due diligence. Such an approach risks violating the Insurance Contracts Act 1984, CTH, by failing to act with the utmost good faith and by potentially engaging in misleading or deceptive conduct if policy terms are not reflective of the actual risk. Another incorrect approach is to rely on outdated or anecdotal information about these conditions, rather than current medical evidence and established underwriting guidelines. This can lead to discriminatory practices and a failure to provide accurate policy terms and conditions, which is contrary to the spirit and letter of Australian consumer protection laws and industry codes of practice. Professional decision-making in such situations requires a systematic process. First, thoroughly understanding the applicant's medical history and current condition, including all relevant diagnostic reports and treatment plans. Second, consulting up-to-date underwriting manuals and medical resources to understand the current actuarial understanding of the risks associated with the specific cardiovascular disorder and its severity. Third, applying these guidelines consistently and fairly, ensuring that any deviations are well documented and justifiable. Finally, communicating any policy limitations or premium adjustments clearly and transparently to the applicant, in line with disclosure obligations. Question 20. The performance metrics show a significant increase in claims related to common digestive disorders, specifically peptic ulcers, inflammatory bowel disease, and cirrhosis. As a claims assessor for an Australian insurer, what is the most appropriate process to ensure fair and accurate assessment of these claims under the GE2N007-15 exam context, which emphasizes medical terminology and insurance? Option A. Immediately deny claims for cirrhosis if the insured is still employed, assuming the condition is not yet severe enough to prevent work, regardless of medical advice. Option B. Conduct a detailed review of all submitted medical reports, physician statements regarding functional capacity, and diagnostic imaging, correlating the findings with the specific policy definitions of disability and the insured's occupational duties to determine the extent of work incapacity. Option C. Expedite claim processing by applying a standard assessment for all claims involving these conditions, assuming a typical recovery period based on general medical knowledge. Option D. Rely primarily on the insured's subjective reporting of pain and discomfort, approving claims if symptoms are consistently described, without requiring extensive medical documentation. The correct answer is B. Conduct a detailed review of all submitted medical reports, physician statements regarding functional capacity, and diagnostic imaging, correlating the findings with the specific policy definitions of disability, and the insured's occupational duties to determine the extent of work incapacity. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an insurance claims assessor to balance the need for efficient claims processing with the ethical and regulatory obligation to accurately assess the impact of complex medical conditions on an insured's ability to work. Misinterpreting the severity or prognosis of conditions like peptic ulcers, inflammatory bowel disease (IBD), or cirrhosis can lead to either underpayment of legitimate claims, causing financial hardship to the insured, or overpayment of fraudulent or exaggerated claims, impacting the insurer's financial stability and potentially increasing premiums for all policyholders. The GE2N007-15 exam context, focusing on medical terminology in insurance, necessitates a precise understanding of these conditions and their implications for disability or income protection policies. Correct approach analysis. The correct approach involves a thorough review of the insured's medical documentation, including diagnostic reports, physicians' assessments of functional capacity, and treatment plans. This approach is right because it aligns with the principles of fair claims handling mandated by Australian insurance regulations, such as the Insurance Contracts Act 1984 and the General Insurance Code of Practice. These frameworks require insurers to act with utmost good faith and to make decisions based on objective evidence. Specifically, understanding that peptic ulcers can lead to complications like perforation or bleeding requiring significant recovery time. IBD, such as Crohn's disease or ulcerative colitis, can cause chronic pain, fatigue, and malabsorption impacting work capacity, and cirrhosis can lead to progressive liver dysfunction with severe systemic effects, is crucial for determining the extent of any work incapacity. The assessor must correlate the medical evidence with the policy's definitions of disability and the insured's occupational duties to ensure a just outcome. Incorrect approach is analysis. An approach that focuses solely on the insured's self-reported symptoms without corroborating medical evidence is incorrect because it fails to adhere to the evidentiary requirements for claims assessment. This can lead to arbitrary decisions and breaches the duty of good faith. An approach that dismisses the claim based on a general understanding of the condition without considering the individual's specific presentation, complications, and physician's prognosis is incorrect. This demonstrates a lack of due diligence and can result in an unfair denial of benefits, violating regulatory expectations for individualized assessment. An approach that prioritizes speed of processing over accuracy by applying a blanket policy to all claims involving these conditions, regardless of individual circumstances, is incorrect. This is a failure to apply the policy terms fairly and equitably, potentially contravening consumer protection provisions within Australian insurance law. Professional reasoning. Professionals should adopt a systematic approach to claims assessment. This involves 1. Verifying policy coverage and definitions. 2. Gathering comprehensive medical evidence from treating physicians, specialists, and diagnostic tests. 3. Analyzing the medical evidence to understand the diagnosis, severity, prognosis, and impact on functional capacity. 4. Correlating the medical assessment with the insured's occupation and policy definitions of disability. 5. Communicating clearly and empathetically with the insured throughout the process. This framework ensures decisions are evidence-based, compliant with regulations, and uphold ethical standards of fairness and good faith.